This year marks the 10th anniversary of Vaccination Week in the Americas, which is held from April 21st to 28th. Bermuda celebrates this milestone by recognizing the progress that has been made in reducing many of the vaccine-preventable diseases that have caused death and disabilities to children around the world, such as measles, rubella, polio, whooping cough, and tetanus. Very few children in Bermuda are now directly affected by these diseases, thanks to the community ensuring their children receive timely immunizations. These are diseases that in the past have caused much suffering and were responsible for death of children at very young ages, and of course continue to affect infants and children in many parts of the world. Throughout this week, the Department of Health wishes to encourage families in Bermuda to continue to make sure that children are immunized on time and according to the Bermuda schedule on immunization. This year will mark the first celebration for World Immunization Week, an initiative that began in the Americas and will now be commemorated in all corners of the globe. All 5 regions of the world will now celebrate World Vaccination Week. The theme is Protect Your World, Get Vaccinated. Vaccines are encouraged for infants, children, adults, and seniors as well. Today, the Department of Health launches their adult immunization schedule. The schedule will assist adults who are not fully immunized as children and may be at risk of transmitting diseases such as whooping cough and measles. Adults are encouraged to check that their shots are up to date, especially the tetanus, diphtheria, with the whooping cough component if they are under the age of 64 years. We must remember, vaccine-preventable diseases are only a plane journey away. There is a real threat of the introduction of these diseases back into Bermuda by persons traveling to Bermuda from areas where outbreaks of these diseases occur. This threat should not be underestimated. Vaccines are safe and they are effective in preventing diseases. Healthcare workers and persons that work in high-risk occupations should consider following the recommended guidelines according to the Bermuda schedule for adult immunizations. Adults should plan to discuss potential immunizations they may require with their doctor at their next annual health checkup. The recommendation has always been to have a tetanus, diphtheria shot every 10 years. We are now advising adults to have the Tdap shot, which is tetanus and diphtheria with whooping cough component. This is the adult version of the childhood vaccination, which can be received to boost a person's immunity. Additionally, keeping a lifetime record of your and your children's immunization is vital. The information may be held in your child's health passport, your international vaccination certificate for travel, or an immunization card. These documents are an important part of your health history. They may be required when you or your family member utilizes health services at the hospital or doctor's office, enrolls in college, or plans to travel to a destination which requires this documentation upon entry. Immunizations have been the most successful public health interventions that have saved lives of children globally. The benefits have expanded into the adult population, and the Department of Health encourages local families to continue these vital vaccination practices to protect Bermuda and the world. To conclude, I would like to thank the community for supporting vaccinations for children and urge us not to become complacent. The re-emergence of vaccine-preventable diseases is a real threat. For further information, contact Child and/or Travel Health Clinics on 278-6460 or email childhealth@gov.bm or speak with your doctor. Thank you, and remember, immunizations saves lives.
Thank you. What we want to do, the Bermuda Advisory Committee on Immunization Practices is now launching our adult immunization schedule, and it's a schedule unlike the schedule for children, and so we're encouraging persons who are adults going to their physician to discuss the immunizations. There are two different categories. One is that those persons who haven't been immunized as children need to be updated, and then there are special category populations that may be at greater risk. So we are asking that you discuss this at your next visit so that you too can participate in being vaccinated. I think we've always thought about vaccines being beneficial to children. We now actually know there's a lot of benefit for the adult population as well. So today's our in recognition of Vaccination Week and World Immunization Week, and we've taken the opportunity to launch our adult immunization schedule. So thank you.